Essentially, this was a single institution study that was conducted at our cancer center, looking at patients with different stages of aggressive lymphoma, which included primarily Hodgkin lymphoma, but also aggressive like diffuse large B-cell lymphoma. And again, it was a single institution study, but really targeted on the catchment area of the University of Rochester, which serves a large population of upstate New York. And so we identified about over 400 patients to really try to understand whether healthcare utilization in younger people was higher than in older adults. And this question emerged from an observation in my practice that I noticed a lot of my younger patients with lymphoma, particularly Hodgkin lymphoma, use the emergency room or urgent care far more frequently than older adults with the same disease. And so we conducted this mixed methods analysis to really probe that hypothesis of whether there's a higher healthcare utilization in those patients. And we did identify that among patients that were adolescent and young adults, there was a greater than twofold risk of having more acute visits to either the emergency room or urgent care compared to their older counterparts. And I think what was surprising about that result was that, you would think that perhaps those with, patients that are older have more comorbidities and perhaps may have a greater need of finding, of needing healthcare outside of their, primary care infrastructure. But rather what we found is the opposite, is that, that observation was confirmed that patients that are adolescent and young adults did have a higher rate of healthcare utilization compared to those that were older. And living far from the cancer center and being obese were two things that were independently associated with needing a higher acute care usage. In particular, acute care visits for psychiatric and substance abuse reasons were significantly higher among patients that were young adults compared to their non-adolescent and young adult counterparts. And I think one of the most important things that came from this study, although again, it was a relatively small single institution study, but I think is really hypothesis generating and helps us really understand that disease-targeted interventions for patients with cancer, particularly lymphoma, that are young adults, they should probably address some of these concerns at the onset. And it really underscores a need for a multidisciplinary model for the care of adolescents and young adults who have many other concerns outside of their lymphoma. As I mentioned, psychiatric concerns, substance abuse disorders, transportation issues. And I think that having the ability to intervene in a multidisciplinary way for these patients when they're diagnosed can really go a long way in terms of helping them deal with their disease better.